Hi, I'm Dr. David Hess, and I'm a primary care physician in West Virginia and have been practicing medicine now for nearly 20 years, seeing tens of thousands of adults and children in my career. My patients sometimes ask me if the COVID vaccines are safe. My answer is yes. COVID vaccines are safe. They were first evaluated in tens of thousands of people who volunteered to participate in clinical trials. These clinical trials followed the same thorough safety and efficacy standards that the FDA sets for all vaccines in the United States. Since then, millions of people in the United States and around the world have received COVID-19 vaccines, and the results from the U.S. and global safety monitoring efforts are excellent. There are rigorous systems in place to quickly identify any safety concerns and take action. These monitoring systems provide information that allows public health and medical experts to update the recommendations and guidelines as needed to ensure COVID-19 vaccination is safe. When it comes down to it, COVID-19 vaccines are safe and effective. Vaccinations save lives. That's why I chose to be vaccinated and why I recommend COVID-19 vaccination to my patients and my family. Thanks for tuning in. I'm Dr. David Hess. For more information about COVID-19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Hi, I'm Dr. Catherine Moffat. I'm a physician specializing in pediatric infectious diseases at West Virginia University. My patients and their caregivers sometimes ask me if children and adolescents can have side effects from COVID-19 vaccination. There can be side effects, although not everyone has them. The side effects that children 12 and up can experience are similar to those in adults. These tend to be mild to moderate and include soreness, redness, and swelling around the injection site, tiredness, headache, chills, fever, or nausea. These effects usually last only a few days, and kids may experience some or none of them. These side effects can be a sign that the immune system is building up its natural defenses against COVID-19, but many people build protection without these signs. Similar to adults, these effects are more common after the second dose, yet that second dose is essential for maximum protection. Although these side effects can occur, they are short-lived and outweighed by the benefits of being protected through vaccination. Many cases of COVID-19 among children and teens are mild, but even mild cases in children can lead to long-term health problems. I've cared for children with COVID-19. Some of their cases can be quite severe. In fact, COVID-19 was among the 10 most common causes of death in children in 2020. And COVID-19 hospitalization rates among teens increased in the spring of 2021. COVID-19 vaccination is a safe and effective way to protect our kids against the virus. It protects not only the person who's vaccinated, but those around them as well, especially children who cannot yet get vaccinated. This is why I recommend that my patients ages 12 and older get vaccinated, and I encourage patients, parents, and caregivers to discuss COVID-19 vaccination with a healthcare provider. Thanks for tuning in. I'm Dr. Catherine Moffat. For more information about COVID-19 vaccines, or to find a location near you, visit vaccinate.wv.gov.
Back to school is almost here. Has your family been vaccinated for COVID-19? West Virginians 12 and older can get vaccinated, and it's the best protection from COVID-19. Protect yourself and your family by getting vaccinated today.
I'm Dr. Jenny Yost, a physician and women's health specialist in West Virginia. I have experience providing gynecologic care to adolescents and young women for over a decade. Are COVID-19 vaccines safe for people who want to have a baby soon or in the future? The answer is yes. COVID-19 vaccines are safe for people who are pregnant, as well as those who may want to become pregnant anytime in the future. There is no evidence that any vaccine, including COVID-19 vaccines, affects people's ability to get pregnant. In fact, leading women's health associations agree that COVID-19 vaccines do not impact fertility. When you get a COVID-19 vaccine, the process of building immunity occurs in the immune system and does not impact the reproductive system. The COVID-19 vaccines have undergone very rigorous safety monitoring. There is no reason to believe that the COVID-19 vaccines will have any impact on the ability to have a baby in the future. So yes, the vaccine is safe for individuals who want to become pregnant in the future. These are just a few reasons why I recommend COVID-19 vaccination to my patients. People who are pregnant or want to get pregnant in the future can choose to get vaccinated. Thanks for tuning in. I'm Dr. Jenny Yost. For more information about COVID-19 vaccines or to find a vaccination location near you, visit vaccinate.wv.gov.
Hello, everyone. It's Monday, September the 13th. Over the weekend, we've had 31 additional deaths. I ask you over and over and over to pay all the respects and honor to these great people that we've lost. You'll hear the second death that I read is a 29-year-old female, and we sure don't want to just be lulled to sleep and think that this is just a disease that is now attacking only the elderly. I think, that we're joined today by Dr. Kutubo and a great senator and a great man and a testimonial from a lady that's going to come on and speak to us. But you'll find, I think, that really and truly this disease is really attacking any and all. And so with that, please join me in honoring these great people that we've lost. But a 77-year-old is our 3,208th death is a 77-year-old from Putnam County. The 3,209th death, a 26-year-old female from Fayette County. 3,210th death, a 44-year-old male from Wood County. 3,211th death, an 83-year-old female from Boone County. 3,212th death, a 75-year-old male from Wood County. 3,213th death, a 72-year-old female from Jefferson County. 3,214th death, a 94-year-old female from Harrison County. 3,215th death, a 52-year-old male from Raleigh County. Our 3,216th death is a 72-year-old male from Kanawha County. Our 3,217th death, an 83-year-old male from Fayette County. Our 3,218th death is a 59-year-old female from Taylor County. Our 3,219th death is a 67-year-old female from Webster County. Our 3,220th death is a 57-year-old male from Wood County. Our 3,221st death is a 54-year-old male from Marshall County. Our 3,222nd death is a 86-year-old male from Kanawha County. Our 3,223rd death is a 51-year-old male from Mason County. Our 3,224th death is an 81-year-old male from Mineral County. Our 3,225th death is a 79-year-old male from Wayne County. Our 3,226th death is a 69-year-old female from Kanawha County. Our 3,227th death, a 30-year-old female from Ohio County. Our 3,228th death is a 76-year-old male from Jefferson County. Our 3,229th death is an 85-year-old male from Harrison County. Our 3,230th death is an 85-year-old female from Harrison County. Our 3,231st death is a 71-year-old female from Jackson County. Our 3,232nd death is a 50-year-old male from Roane County. Our 3,233rd death is a 56-year-old female from Harrison County. Our 3,234th death is a 67-year-old male from Randolph County. Our 3,235th death is a 43-year-old male from Kanawha County. Our 3,236th death is a 55-year-old male from Mingo County. Our 3,237th death is a 57-year-old male from Monongahela County. Our 3,238th death is an 83-year-old female from from Cabell County. One more time, our 3,238th death is an 83-year-old female from Cabell County. 3,238 deaths. It's a long story. And like I said, Dr. Tom Katubo is with us. We have two special guests joining us today. Linda Lanier and her son Joe are with us today. So Senator Katubo, who's right here with us, and if you could tune us in to Linda and her son Joe. Are we going to do that right now?
Sure, Linda. With us this time. It's just me. Jay is still in the hospital, and he still happened to be sedated because he is coughing a lot and his vitals are going up. So, but I'm sure you will hear Joe's story. He will be on again for you. Are you going to start the pictures, or am I going to start talking first?
Linda, you do whatever you'd like to do.
Okay. All right. Before I start, I'd like to thank God and all of our friends and family everywhere for supporting us with prayer, because we wouldn't be this far without them. In addition, I would like to thank the nurses at CAMC Open Heart Recovery and SICU, along with pulmonary associates, Dr. Kister, Joby Joseph, and Darshan DeVay. Without their dedication, compassion, and knowledge, along with prayers, Joe wouldn't be here. Now I'd like to share Joey's story. He decided not to get vaccinated. And I hope by sharing his story that it will change some people's minds. Joe wears many hats and is known by many names. Some of you know him as Joe. Some of you know him as Smokin' Joe, Zeke from Cabin Creek, Goody, and I'm sure there are some that I don't know about. He may be just an acquaintance or a longtime friend. Some of you might have been an opponent of his in the ring or on the football field, or you might have been a customer of his in his barbershop. He also wears the hat of a general manager for Canal Falls PSD with pride. However, the hat that Joe was most proud of is the hat of a Christian man and the father to his two sons. On July 16th, 2021, Joe went on a trip to an attraction that has both inside and outside facilities. When we made these plans, everybody had kind of slacked off on wearing masks and social distancing. So we didn't give it a thought. We went. This place is a place that puts thousands of people through in a day with no social distancing, no mask, and no ventilation. It was a very poor choice on our part. And for that, Joey ended up with COVID. I ended up with COVID, and my husband ended up with COVID. I'd had the vaccine, so did my husband, and we had the antibodies, and we did not have a hard time. But Joey, on the other hand, he was on his family vacation, and he became very sick. Started throwing up. He threw up for like a week. He thought he had a stomach bug. Then when he came back from his vacation, I told him, I said, Joey, you need to go straight to Memorial and you need to be seen. And he did that, and he was admitted. But before Joey got so sick that he couldn't talk, he told people, get vaccinated. You don't want this stuff. Several of his friends have gotten vaccinated since that time. Well, the next morning after Joey went to the hospital, I received a call from Dr. Takubo. He said, your boy's in trouble. Joey was put on the vent and the ECMO machine, which is a machine that functions for your lungs, that lets your lungs rest so that you can get a little bit healthier and your lungs work a little bit better. Joe began at that moment to fight for his life. He's still fighting. The ECMO was removed after about 5 weeks, but he's still sedated on the vent, and we're now headed into 7 weeks. Joey chose not to be vaccinated because he listened to all the negative and false accusations about vaccination. Being in the medical field myself, I tried to convince him. However, it didn't work. He listened to his friends, he listened to social media, and he just listened to what I call the garbage that's out there. If you have questions, go to a physician. Go to someone that knows. Let them answer your questions, because that's where the true answers are. This COVID is a monster. I mean, if it can take down my son, the MMA fighter, the tough man, which is 1 times 3, maybe 4, linebacker, a very strong person, knocked down, I mean, completely knocked down, probably cannot even lift his arms now. What's it going to do to the average person? What's it going to do to your children? You need to take this very serious. Before I go, I want to share one more thing with you. When I told my grandson, which is Joey's sons, Jason's 11 and Jackson's 7. I'm going to tell your dad's story. Jason said, I want to tell them my story. I asked him, I said, what do you want to say? He said, I miss my daddy. I want him to wake up. I need to talk to my daddy. Jackson, on the other hand, he's a little bit quieter, but I was watching them yesterday while their mom visited Joey. And Jackson told me, I said, your birthday's coming up. He said, yes. He said, for my birthday, I want my daddy to get better. So everybody, do your part. Get vaccinated. Social distance. Wear your mask. And avoid huge crowds. Thank you.
Linda, before we go to Doc, let me just say this. You know, the notes I had, I was very hopeful that Joe was going to be able to speak to us from the hospital. I would just say to you, it takes so much courage, and so much courage from him and everything to be fighting. And just like you just said, if this dreaded disease can take down this tremendous athlete, a man that is strong beyond belief and very young in years, can it not take us all down? And that's what this testimony is all about. And it's a family that has absolutely stepped up to try to help all of us. And with all that, a million billion prayers, but especially prayers for those grandsons and those kids of this great man. You know, can you just imagine? Can you just imagine? And it's happened over and over and over. But sons, daughters, grandsons, granddaughters, just saying, I just would like to talk to my dad or grandma or mom. But thank you so much. It's real courage. And Doc, please add what you'd like to talk to us about, please.
Yeah, Linda, thank you for that and for getting that message out. And, you know, we'll certainly keep Joey in our prayers, and we're going to continue to fight for him just as hard as we possibly can. Linda's story is not unique. Since the beginning of this pandemic, we've had to, as medical workers, the nurses and respiratory therapists, the physicians, they've had to relive this over and over and over, time and time again. And at the very beginning of this, when we saw it coming down and we tried to prepare, you know, the initial computer model showed that West Virginia was an older population, we're a sicker population. We were going to get hit exceptionally hard. I got on the phone with my colleagues at Marshall University and WVU, and what we tried to do is coalesce all the information we had at the time to best prep to take care of the citizens of West Virginia, and to make sure that even if you were at a bigger hospital, smaller hospital, all the critical care docs would make themselves available to take calls to assist the smaller hospitals. And at the time, we had a regimen of hydroxychloroquine, azithromycin, avoid nebulizers, avoid steroids. That's what the medical literature had at the time and said, this is what you should do. And over the course of this pandemic, we've tried it all. We have tried ivermectin. We have tried high-dose inhaled steroids. You name it, we've tried. Anything we could possibly do to help get people through this and survive, we've tried it. I've said from the very beginning, pay attention to your hospitals. You know, the media is so toxic these days. In any situation, it can't be too innocent that people try to sway it. But I've said from the beginning, watch your local hospital. That will tell you what's happening in your community. And what we're seeing now is this is a pandemic primarily of the unvaccinated. We've tried a lot of things. A lot of things didn't work. A lot of things we were told not to do turned out we should have been doing. So as we've gone along and become more educated and more experienced, we've learned a lot. And things like ECMO that Joey was on, there is zero doubt he would not have survived had we done that. He's still fighting, but it gave him a chance. It gave him a fight. And so we're doing all that we can. The governor and the state's helped tremendously in trying to get additional resources, everything we've come to ask for. But what I would encourage everybody to do is be careful about what you're reading on social media, what you're reading on the internet. Listen to your local providers that are seeing this firsthand, that are having to sit down and have conversations like we had with Linda time and time again. It doesn't matter if it's mama or papa or mom or dad or your husband or your child. We love them. We want to save them. We're doing everything we can to help them. But we can help ourselves, because the one thing I'm seeing is the vaccine does work. 88 to 95% of all patients being admitted are unvaccinated. So you have to look at the real numbers, whether you like Fauci, don't like Fauci, whatever. The vaccines are working. So when they come to me and say, Doc, what works and what doesn't work, I'm telling you, the vaccines are working. They're keeping people safer. They're keeping people out of the hospital. Linda and her husband did great because they were vaccinated, and the same virus is doing something horrible to their healthy 40-year-old son. So that's the take-home message. Again, keep everybody in your thoughts and prayers, and please keep your healthcare workers in your thoughts and prayers, because it is rough to go in every day and do a tough job already, but to see the absolute heartbreak on the families of these individuals has a toll, and keep them in your thoughts and prayers also.
Well, Doc, thank you, and Linda, thank you, and please tell Joe that we love him, and we're going to continue to pray in every way, and especially those sons and grandsons, and just oh man, it's just, I mean, I don't know how many times we're going to have to go through the same thing, but none of us, and absolutely, I've told you wholeheartedly, I am adamantly against mandating masks. I've told you I'm adamantly against mandating, the vaccine, or, that you've got to get vaccinated. I'm absolutely, I am bewildered, not really, but bewildered in some ways, about the Biden administration, trying to do what they're trying to do to our businesses to make, businesses in excess of over 100 employees, and there's lots and lots and lots of those that have to get everybody vaccinated. Well, that's really not a ploy other than one thing, and that is just to change the narrative. The Biden administration has been such an absolute disaster, from the standpoint of the situation in Afghanistan, or inflation, or all of the stuff, with our southern border, or whatever it may be. I mean, the Biden administration has absolutely has been a catastrophe, and with all of that, what are they trying to do? They're trying to basically change the narrative. And if we don't watch out, and I have shot shots across, the Republican governor's bowels, in just this, I believe wholeheartedly we should continue to encourage everyone to think about it, to discuss with their doctors, to get more and more and more educated, and we've got to get them vaccinated. You've got a doctor here that's a great senator, and he does unbelievable work, I'm sure, in the medical field all the time. He just took care of my aunt and uncle, and they're doing okay and everything. And my uncle is in excess of 90 years old. and they're doing okay, but nevertheless, you just think about just this. He said something that is really profound. This disease now is totally about the unvaccinated. And he said something before, and I hope that I'm not breaching anything that he didn't want me to say, but he said something that really, really is impactful. He said, if you haven't been vaccinated, one of the two things is probably going to happen. Either you're going to get COVID and get over it, and if you live through it and you get over it, you're going to probably have antibodies that are going to help and protect you to some degree, or you're going to get vaccinated. One of the two things is probably going to happen. This disease is not about those that have been vaccinated. This disease now is all about the unvaccinated. And so with that, I've said to you over and over, and I'll read through the numbers right here with you in just 1 second, but I've said to you over and over, there is nothing. There is nothing that you're doing. I don't care what it is. There is nothing that absolutely gets anywhere close to how important it is for you to get vaccinated today. That's all there is to it. All I can do is just tell you and tell you and tell you. It's your choice, and it's going to be your choice as far as I'm concerned. But with all of that, if you choose not to get vaccinated, there's an awfully good chance that things are not going to be really good for you. That's all there is to it. We've got a technical problem with the dashboard today, but these numbers I'm going to give you are correct. We have 1,417 new positive cases since the last time we were together. Our daily positivity rate's at 12.12%. It's off the chart. Our cumulative positive is at 5.52. It continues to go up. And we have 27,607 people that are active cases. A bunch of those will die. A bunch of them will die. We have 852 people that are hospitalized. It's an all-time record. We have 267 patients in the ICU unit, all-time record. We have 164 people that are on ventilators, all-time record. A bunch of those will die too. We have a sprinkle of counties that aren't in the red, but for the most part, our whole state is blazing red. We have 89 outbreaks in 33 counties in our schools. We have 5 schools that are closed. 51 counties have mask mandates, for K through 12. Putnam, Pocahontas, Ohio, and Mingo are the only 4 that don't have a mask mandate. Overwhelmingly, the number of people that are going into the hospitals have not been vaccinated. It's just the same story over and over and over. It's a broken record beyond total belief. I remind you about being 65 and older, especially if you get any symptom, go get a test. The antibodies are waiting on you that Dr. Katubo just went through. I can't say enough. This man is a quiet, calming voice in our Senate. He is absolutely a brilliant mind, a superstar beyond belief. He has done unbelievable work. He continues to do just that. We have got to listen to these people. We have got to listen to these experts that are telling us what we really need to be doing. I encourage you, if you're in a crowd, especially if you're 65 and older, if you're compromised in any way, wear a mask. If from the standpoint of the FDA, Pfizer is fully approved, we're ready to go on the booster shots. We have gotten out in front and led the nation in lots of different ways, but the booster shots, I am pleading with the Biden administration for us to be able to give them. We got 6,300 people vaccinated over the weekend. That's 6,300. There's no question that there's lives being saved and everything. We're up to 1,149,151 of our total population that can get the shot that's 12 and above. We're at 92.4% of the 65 and older. We're at 86.3% of the 50 and olders that have had one shot, and 73.8% of the total population has had one shot. We've had, in this Do It for Baby Dog Round 2, we've had 203,000 residents sign up. We're going to continue to give away the stuff. It's tailored toward our younger population. We're trying every way in the world to get our younger population across the finish line and get them vaccinated. As I've said over and over, the vaccines are available 12 and up right now. We don't have any approval for anything under 12. From the standpoint of our grandparents and our parents helping us with the younger folks, please continue to do so. All the vaccine stuff is up on our hotline. It always is there. I encourage you about getting tested and the free testing. Take advantage. Walgreens and Frith, I thank them over and over. We have 77 outbreaks in our long-term care facilities now. 3 outbreaks in our church community. Our church community has done better. That's Monroe, Raleigh, and Wayne counties. We have 164 inmates that have this at 11 facilities and 45 staff cases. I encourage you over and over about giving blood. Our grandfamilies, we need our families to step up here and really help us. That's 19,000 kids in those grandfamilies, and they can really help us. And we'll give them this, $150 school voucher if they'll just help us get everybody in their houses vaccinated. And that's all I got right now. Again, the message is really simple, and that is just this. This disease now is, and I can't tell you how much Doc said it and described it the best. This disease now is a disease of the unvaccinated. That's all there is to it. The disease of the unvaccinated. So your choice, but for God's sakes a living, I believe I'd be running over top of somebody getting vaccinated because it's safe, and we've seen the effectiveness over and over. All the experts tell us on and on and on. Thank you so much.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon, and in following up with what the governor, Dr. Takubo, and our guest who told her story have said, that we continue to see growth of COVID-19 in our hospital systems, and particularly in the places in our hospital systems that take care of our sickest people. So today we have more people in West Virginia hospitals than we've had at any other point during the COVID pandemic. And just as a reference point, today we have 852 West Virginians with COVID in our state's hospitals. The first week of July, that was 52. We have 267 West Virginians in our ICUs with COVID. The first week of July, that was 17. And we have 162 West Virginians on ventilators today. The first week in July, that was 6. So we have seen explosive growth from the Delta variant of COVID-19, as many other places has seen. We know that ultimately, as the governor and Dr. Takubo have said, that the majority of people, overwhelming majority of people in our hospitals and our ICUs and using ventilators are unvaccinated. About 85% of those in West Virginia hospitals are unvaccinated. About 90% of those in our ICUs are unvaccinated. And between 91 and 93% of our citizens who have COVID on mechanical ventilators are unvaccinated. We know that the way to protect ourselves and protect each other is to get fully vaccinated. And as we have said, getting vaccinated today will not remove the surge that we're having, but certainly will protect us in the longer term. And importantly, protect those of you who have not been vaccinated when you do get vaccine from the most severe consequences. New data from the CDC suggests that full vaccination gives you a 5 times improved reduced risk of getting COVID and over 10 times reduction in risk of getting hospitalized or dying of COVID. So this is really important right now as we continue to see our hospitals get more full. In the state of Idaho, that's also seen a great surge in their cases. In parts of Idaho, they have begun to ration care. They have now, the government has given the hospital systems the ability to limit certain areas of care. And there was recently a report that a gentleman, I think in Mississippi, who had a heart attack, went to over 20 emergency rooms and could not get seen and ended up dying of his heart attack. So this is what we're really worried about in West Virginia as we see the numbers of very, very sick West Virginians continue to go up. And as the governor has said many times, if you are infected with COVID and you are at a risk age, greater than 60, 65, or have coexisting medical problems, then you should talk to your doctor about getting an antibody infusion. Certainly the way to protect yourself at all ages is to choose full vaccination. And that is so important for us today, but really important for us as we go forward in the future, as we see the winter time coming and understand that that's going to be another big risk time to us. West Virginia, this is a time for us to answer the call to run to the fire, as the governor has said, and full vaccination is the way to go. Boosters are likely to start September 20th. It's debated now exactly who will be first in line for boosters, but we can predict, I think with some certainty, that at least our oldest part of our population, nursing home population, assisted living population, and elders over, not really elders, people over 60, 65 years old who've been 6 months or greater from their vaccination would certainly be prime candidates. And the FDA is now trying to move more quickly to get vaccinations approved for children 5 to 11, which looks like it may happen as early as sometime in October. Thank you.
Thank you, Dr. Marsh. We're going to go back to Governor Justice for just a second.
Okay, we've still got a real resource with us, and Dr. Takubo. And but if Dr. Takubo would speak again, we were talking as Dr. Marsh was speaking and everything, but I think it's so impactful and so important that you hear from a real resource and everything. You've heard from Dr. Marsh and myself over and over, Dr. Amjad and everything, but Doc, if you could come back and talk to us about what we were talking about.
Yeah, thank you, Governor. So one of the concerns that a lot of people say is, well, I don't want to take the vaccine because there's a potential for some side effect that may happen. So, the two things I tell people is show me a hospital that's overran by vaccine injuries. I mean, I've yet to admit one person or take care of one person with an injury from the vaccine. Now, when you get the vaccine, there's a difference between an adverse reaction and side effect. So if you get the vaccine and you have aches and chills and soreness in your arm, that's letting you know the vaccine worked. In fact, I would almost be a little more concerned if I had no reaction at all to the vaccine. But what the governor and I was talking about is in the office, in the outpatient setting, people say, well, I'll just get COVID. Every single day in the outpatient office, we're seeing patients with complications from COVID infection. In fact, the literature clearly states up to 5 months, many people are still having symptoms and not fully back to normal after COVID infection. We're treating every day blood clots in the lungs, blood clots in the legs, problems with the heart, hypertension, people that's had strokes, people that's still having chronic shortness of breath from COVID infection. So who knows what COVID infection is going to do long term? We know that there's people all over the internet that's concerned about the possible long-term effects from a vaccine, but again, look at what's going on in your local hospitals. The people that are primarily dying, the people that are primarily in the ICUs on a ventilator, 95 to 99% are unvaccinated individuals. So even though you may survive COVID, it's just worrisome to me to see, 2, 5, 10 years, what's going to be the long-term effect from that COVID infection? Yeah, you may get some antibody protection, and you survive the initial illness, but what's going to be the long-term effect? And I think that's something that a lot of people don't pay attention to.
Well, Doc, thank you. And can I just go over this one more time, just exactly what Doc just said? He said, first of all, he has not treated a single patient, not one patient has he treated with a significant adverse reaction to taking the vaccine. Am I correct in that, sir? Okay. And the other thing he said is this, that 50% of the people that have COVID 5 months later are still having some kind of side effect from that. Is that correct also?
The case report shows that a significant proportion of people that have COVID still have effects 5 months.
Yeah. Well, and then the argument behind, well, I'll just get COVID and then I'll get over it and then I'll be fine. Versus take the vaccine. Here's a doctor that has not treated one person yet, and he surely said that we're not getting overrun at a hospital because we have people that are having adverse reactions to the vaccine. Anything but that. Really and truly what we've really got is almost no one has had a significant adverse reaction to the vaccine. So that's your choice. Your choice is almost no one has had a bad reaction to the vaccine. And your choice also is if you get COVID and you think that's a way out of this thing, people are having long-term, very significant long-term negative effects from having COVID. If you survive. I mean, you got to listen. You got to listen to these people. These people are really good people, and they're really smart, and they're trying to save your life every day. But I guess Secretary Crouch, is he? Say what? He's just next. Okay. I'm back to you, Nathan.
All right, thank you, Governor, and thank you, Dr. Takubo. We'll now go to Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. As the governor said, we are experiencing a technical delay with the dashboard. We apologize for that inconvenience. We're troubleshooting that and trying to figure out exactly where that is. The screenshots that the governor did show today and that Jordan put up are accurate. We just can't get this up live on the dashboard. We're working hard on that. Thank you. Also, the COVID pandemic has had a major effect on all of our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. Public health actions such as social distancing are necessary to reduce the spread of COVID-19, but they can make us feel isolated and lonely and can increase stress and anxiety. If you are experiencing stress and it gets in the way of your daily life, talk to your healthcare provider. Mental health services can be very beneficial. I encourage you to resist the urge to stigmatize yourself or feel embarrassed to reach out for help as needed. Please also remember there are free confidential resources available. Help 304 is one resource. You can call 1-877-HELP-304 or 1-877-435-7304 if you prefer to text. So for texting, that is 1-877-435-7304. And you can chat on help304.com. In addition, Optum, part of United Health Group, offers this emotional support helpline. Professionally trained mental health staff are there to support people who may be suffering from fear or stress created by COVID-19. Optum's emotional support line number is 866-342-6666. 6892, and will be open 24 hours a day, 7 days a week. This service is free of charge and open to all PEIA members. Again, if you feel emotionally detached, if you need to talk to someone, please utilize these resources. Protect yourself, take care of yourself, and take care of your family. Thank you.
Thank you, Secretary Crouch. Retired Major General Jim Hoyer, Director of our Joint Interagency Task Force, and Dr. Ayn Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. Our first question today is from Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, in spring 2020, one of the earliest actions, in response to the pandemic we took was limiting elective procedures at hospitals. Could you explain why we haven't done that yet, or what are we waiting on to do that? The hospitals are fuller than they ever have been, but we still haven't heard that action yet. Thank you.
There's all kinds of plans on that, Charles. The interagency task force is working on all that and everything. As far as limiting the elective surgeries and everything, that's absolutely on the board. Everybody's working it, and everybody's trying to. For this moment, I think we're probably still okay in regard to that. But Charles, there's plenty of stories that are out there that you're right on the verge of doing that, and if you're right on the verge of doing that, that's going to have an economic impact to that hospital like you can't imagine. But for the most part, Charles, there's just beginning to be horror story after horror story, and that's the biggest danger that we've got to worry about. Is we're going to get in a situation where our hospitals are virtually overrun with people. And so all the experts and everybody are working on that every day. And as we continue to trend negatively, that'll absolutely become a reality.
Thank you, Charles. Next, we'll go to David Beard with the Dominion Post.
Hi, I'm going to try to formulate this question so it makes some kind of sense. We had people talking earlier about trying to deal with misinformation, rely on your physicians and people you trust to give you the correct information about the vaccine. And I don't personally watch TV news of either end of the spectrum just because it kind of drives me bonkers. But I happened to be visiting someone yesterday who had a news network tuned in, and there they had doctors and political leaders talking about the vaccine, saying, they don't want these foreign things injected in their bodies. The vaccine doesn't work. It could affect your heart, cause heart damage. When you've got people at that kind of level, kind of opposing your message, it seems like an uphill battle. How do you? I guess the question is, how do you deal with that kind of uphill battle and get information out that you think you need to get out? Sorry, that's so vague, but that's where I'm at. Thanks.
David, it's one of the things really and truly that all of our means to communicate through all the different vehicles that we have through social media or wherever it may be, have become lightning rods in lots of different ways. And in that, again, our good doctor here, one of the things he said was, you can't listen to misinformation that maybe the media is reporting or whatever, that could lead you in a direction that's, a bad choice. But with all that, all I can possibly do is come here and tell you over and over what I know is the truth. You get people that are grandstanding in every direction, and coming up with all these off-the-wall ideas all over the place all the time. But you've got a doc that's sitting right here that's on the front lines every day and pleading with people to absolutely be appreciative and know the sacrifice that not only he's making, but the nurses and all the different people at the hospitals and everything that they're doing. And you've got another doc, that is our coronavirus czar, that is telling us, and you've got our doc in-house and Dr. Amjad that are telling us. You've got a general that's telling us. I don't know how you do it any other way. And David, it's terribly frustrating, but the choices are just lay your pen down and tell everybody, I hope the best for you, and we'll see you, in a month, good luck, but or keep coming in front of you with, good doc that we have here and the two docs that we have on the Zoom and the great testimony, from Linda about her son, and here's a champion guy. I mean, a guy that was the toughest of the toughest of the toughest, and he's still fighting for his life. And, I don't know how you do it any other way. And so, David, it's either throw the towel in and wish everybody good luck, or keep coming in front of you and trying to convince you of what is the truth. And, we've got ladies that are or people that are outside the Capitol right now, and they're upset with Joe Biden, and I understand they're upset with Joe Biden, and they want to absolutely have a free choice as to whether or not they should be vaccinated or not, and I concur 1,000%. But at the same time, all of them need to be vaccinated. And we need them to make the right decision. It's their decision. It's not Joe Biden's decision. It's not Jim Justice's decision. It's their decision, but we really hope and pray they'll make the right decision.
Thank you, David. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Attorney General Patrick Morrisey released an advisory opinion at the request of House Speaker Roger Hanshaw and Senate President Craig Blair. Released that advisory opinion Friday evening. I think it's still being digested by lawmakers, but there is some thought process among lawmakers that advisory opinion doesn't really answer the question, the three questions that were asked about, which was in regards to vaccine mandates for state employees, vaccine passports for businesses to require such a thing, and the legalities of those issues. And I know you've stated unequivocally you don't plan to do any of that anyway. But I didn't know if you had time or if your team had time to review that advisory opinion, and if you had any thoughts about it. Thank you.
No, my team surely has had time to review it, and I've told you my position over and over, Stephen, and I think there's certain things that it does not answer, but everybody knows my position. My position is where it's been. It hadn't changed. I think we've got to be smart enough to know that as we go forward, things can happen. They're happening every day, and we have to adjust and everything. No playbook. We've been through all that 15,000 times. But right now, and where I have been steadfast is I have been steadfast in the no mandates, period. I think the Biden administration and what they're doing is way out in left field, and I think it's done just to change the press, change the narrative of what's going on. I think I've said this over and over and over. I mean, I said this at the last briefing, and I was just reminded about this, but businesses should make their decisions. It's a private business, for God's sakes, a living, And that private business, if they have 10 employees and that private business decided they wanted to make it mandatory that their employees be vaccinated, that's their decision. I don't think that'll happen, but that's their decision, And absolutely what wholeheartedly we should not be telling the business in any way that they have to make every one of their employees take the shots and get the vaccine. That is not our decision, especially not our decision as Republicans. But absolutely, that is not our decision, to be made. It is the business's decision. That's what's founded this whole country. Those freedoms have founded our whole country, period. And that's all there is to it. And so that's where I'm going to stand.
Thank you, Steve. Next, we'll go to Kelsey Soto with WSAZ.
Good afternoon, Governor and team. This question is probably for Dr. Marsh, but I know we've kind of talked about this over the last few weeks, but I'm really hoping to kind of buckle down and get some clarity on the third doses or booster shots, as some are calling them. I know there's been mixed messaging at the federal level, and that's kind of impacted our ability here. But I'm really wondering, what is West Virginia's message right now? I mean, I know on the dashboard it says, I think 9,400 people have gotten a third dose. Is this something you're recommending? Are you wanting people to go and get them? Or is it available? And just kind of, who should be going, and what's a good, reasonable timeline to maybe revisit if we are waiting?
Okay, Dr. Marsh, that's you.
Thank you, Governor, and thank you, Kelsey. From the booster standpoint, right now, the Food and Drug Administration and the CDC have not given authorization for boosters. And this is a confusing nomenclature. What the approval has been given for is for people who are immunocompromised to be able to get a third dose of the vaccine. And that is based on data that demonstrates that people, say, who take drugs to suppress their immune system, or who have had a transplant, or who are getting chemotherapy for a cancer, or have certain types of cancer, they don't respond immunologically normally. And data has shown that with the first dose and the second dose of the mRNA vaccines, they may not have responded as well as would be necessary to protect them from the Delta variant. So the recommendation was made by the FDA and the CDC that these people should get a third dose of vaccine. And as you've articulated, many people have. Boosters, on the other hand, is a term that's reserved for people that have had 2 doses of vaccine, but had the 2 doses of vaccine a long time ago. In studies from Israel, that is over 5 or 6 months since their last vaccine. And what the Biden administration suggested initially was 8 months from the end of their second vaccine. But what's been demonstrated is, particularly for the Pfizer vaccine, that there has been a reduction in potency of the vaccine that basically makes people more at risk to get infected with COVID-19. So the vaccines, when the first, say, 3 to 6 months, are about 92% able to reduce infection with the vaccine, with the infection. And now, about 6 months or after, the Pfizer vaccines are more in the 75 to 80% range. And in Israel, what they found was that 6 months after the second vaccine, that people over 60 years old were seeing more, not only infections, vaccine breakthrough infections, but some of these people, particularly people older and sicker, were actually getting sick. So Israel started to provide these booster doses for their citizens, and saw, after about 10 days, they saw an almost 90% reduction in serious infections in their most vulnerable people. So we would recommend, certainly based on, we're waiting until the FDA and CDC makes their recommendations, but we would certainly advise people that are older, say greater than 60 or 65, who have been more than, say, 6 months after their second vaccine, certainly pay attention to what the FDA and the CDC is saying, because these people will likely very much benefit from a booster vaccine. And again, if you've gotten 2 shots of Pfizer, we presume the next shot will be a Pfizer vaccine. If you've had 2 shots of Moderna, the next shot will likely be a Moderna vaccine. There's controversy about if younger people who have been, 6 months or perhaps 8 months, depending on what the FDA and CDC recommend, if those people will benefit and will be recommended to get the vaccine. That is not as clear, but certainly older Americans and West Virginians who have been, out 6 to 8 months, depending on what the FDA, CDC says, they would be certainly benefiting, I believe, from a booster. And that is something that we've really pushed for, because remember, we were the first in the country to immunize our nursing home assisted living residents, and we're among the first in the country to vaccinate our elders, because we know that the majority of our deaths happen in our older part of our population. So we are very much interested in waiting to be able to give boosters to those targeted groups of people. Thank you.
Thank you, Kelsey. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor, and good afternoon, Cabinet members and others in attendance. From time to time, I've shared some personal medical information on this briefing. This is one of those occasions where I want to mention it again, because I'm lucky enough to be one of the 9,400 people who have gotten the 3rd dose. I have checked the boxes, yes, on the 5 highest risk categories for COVID-19. So I was advised to get the shot because I've had a lot of health problems this year. And I just want to say, listen to your doctors, one of which is mine is sitting with you, Governor. Tom Takuba is my pulmonologist, and he's been a great doctor. And I listen to what he says. I take his advice and I follow his direction very well. So thank you, Tom. God bless you as a friend and as one of my physicians in a very tough year for me, medically speaking. My question is regarding other federal issues, including, I know we had trouble getting authorization for the 3rd doses, but I'm hearing that we're also having trouble getting federal permission or authorization for the antibody therapies on a widespread scale here in West Virginia. Are we encouraging or encountering a supply chain problem, or are we having problems with the federal government authorizing widespread use of these antibody therapies?
I'm going to defer to General Hoyer on this, but Mark, Dr. Takuba had to leave and everything, but I'll pass on your comments to him, and I'm sure he'll hear those. And he is a terrific doctor, and he's a great senator as well. But anyway, General Hoyer, if you can answer Mark's question, please.
Yes, sir, Governor. Mark, there was some national issue, supply chain concerns on antibodies, but we, as of today, are in good shape in West Virginia. And currently, Dr. Amjad and the team from the Interagency Task Force are working with the Primary Care Association, and we'll be expanding access to that across the primary care centers, the clinics across the state, as well in pharmacies. The other person helping to lead that effort is Dr. Krista Capehart from the State Board of Pharmacy. So I am not aware of any large scale issues. If somebody does need the antibody and they've been prescribed by a doctor and they're having difficulties, they should contact our helpline, our hotline, and they will help folks get directed to the right locations. Thank you.
Thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everybody. Because of where I'm situated, I get to cover 2 states, West Virginia and Maryland. And at the end of last week, Maryland Governor Larry Hogan announced that he was authorizing long-term care facilities with senior citizens to vaccinate the residents there because he considered them at risk. This is a follow-up to my question from Friday on why don't you go ahead and do it and make the Biden administration stop you? Governor Hogan apparently has taken that tack with the senior citizens in congregate care in Maryland. I guess my question is, why don't you? Thank you.
Well, Paul, the answer is just the same. You know, I'm really, really concerned that, and I really, you know me, Paul, I've surely not been hesitant on any action, and as West Virginia has led the way, but with all of that, I am hesitant from the standpoint of this. If the federal government, and right now, the Biden administration is so unpredictable. Right now, if they start moving, COVID shots away from us, or antibodies, that they start moving them in directions that we can't get those and everything, we'll be in a really, really tough spot. Now, I think General Hoyer could add something to this, but the bottom line to the whole thing is everybody's gun shy of the fact of what the Biden administration is going to do. If we jump out and start vaccinating with booster shots, our nursing homes and everything, can they curtail our vaccines, send them to other states or whatever it may be, and then we be in a heck of a shape. And so, General, come on and you may be able to add something to this.
So, Paul, I think if you look at the executive order that was issued, it's by the Maryland governor. It refers specifically to and follow all CDC guidelines. So I'm not sure that they're doing anything different right now than what we would be doing in West Virginia. So I would suggest you might want to look at that and see what that executive order actually lays out. Thank you.
Thank you, Paul. Next, we'll go to Annie Moore with WVVA.
And Governor, with the dramatic increase in Delta variant cases, are we seeing any new trends among children and teen? How sick are they getting? Are they getting hospitalized? To what extent are you all seeing? What are you guys seeing on the ground there?
You can answer that one.
Sorry, Governor, you cut out. Who did you ask for?
Dr. Amjad, maybe could she answer that one for us?
Sure. Yes, Annie. I'm just pulling up some of my numbers here. But yeah, I mean, we have about, let me see here. We are seeing some large cases. Our 5 to 11-year-olds, we had about 1,300 cases over the last couple of days and about 1,100 cases in the 12 to 15-year-olds. So we're having a lot of cases in the elementary school ages, I would say. As far as our hospital cases, we do have a significant amount in the hospital. So we still want kids who are 12 and older to get vaccinated. And also, if your kids are in the school age group, to wear masks indoors if possible, if they can tolerate it as well. But we are seeing large cases along the school age populations. Thanks.
Thank you, Annie. We'll go back to the governor now.
Well, we don't want to ever have any computer glitch or whatever like that, but I've just been advised that our dashboard's up and it's working and it's reflecting, I think, the numbers that we've already reported to you. But the only thing I would say is just this, is, we have an incredible testimony from a beautiful lady today about her son that's really having a hard time, and about her son that was just a mountain of a man. And I'm sure and I hope and pray in every way that he's going to survive and get through this and be that mountain of a man for his sons for long, long decades and decades to come. And we're going to always continue to offer up those prayers. And I'll promise you, Linda, that when we leave here, I'll sit quietly by myself and say a very detailed prayer, because we need him to survive. We need him to do well, and the reality is we just have story after story that are exactly like that. A great doc, a great friend just called over the weekend. Her hospital is right on the verge of being maxed out. She's talking about, that we just lost a gentleman that was middle age, and I surely don't want to give away any information here, but middle age, that she said we were fighting with the fact that we wanted so badly to get him dialysis, but no means to be able to get that done. No place would accept him, no place to go, and in all that, with COVID, they lost him. Now, there's story after story after story, just exactly the same. Dr. Katubo just got through discussing and going through the whole thing with us and saying, this is the disease of the unvaccinated. He also said that people that do come in contact with COVID, 5 months later, a great percentage of those people end up with all kinds of bad side effects. They could carry those side effects through their whole life, whether they be blood clots, whether they be, all kinds of heart issues, whatever it may be. Why in the world can't we just listen, and on a voluntary basis, why can't we just go get vaccinated? Why in the world can't we do that on a voluntary basis? Nobody's holding a gun at anybody's head. Nobody's saying you have to do this. But really and truly, why can't we do it on a voluntary basis? And then we can stop all the rhetoric. That we can stop all the rhetoric from saying, by God, I ain't doing it, this is my freedom. We don't have to have that rhetoric if we'll just listen to good common sense. We'll make our own decisions. We won't need any mandates. But what we hope and pray is we'll get such a high percentage of people that have stepped up and gotten vaccinated that we can stop this thing. We can stop this dreaded killer. I don't know the exact number. I think it's 31. It was 31. 31 deaths that I read to you today. 38 deaths I read to you last Friday. It's a lottery. It's a lottery. And as that wheel turns, it's a lottery that's a death lottery. It won't stop. It will not stop unless we absolutely get ourselves vaccinated. And we get to a percentage level to where we break the chain. I really appreciate Doc coming on. I really appreciate, Dr. Marsh, Dr. Amjad, all the different people that really put in all the licks every day. Dr. Katubo is when he spoke with us today, he said that it weighs really heavily on all those folks that are at the hospital and everything, because they're trying so hard to save people's lives. And when they pass, it just is really, it's hard on them. And I know that. It's hard on all of us. And some way, somehow, we got to stop it. I wish to goodness we had other things in the arsenal to be able to stop it. But the only thing we got is one thing and one thing alone, and that's to get vaccinated. We do not have any other ammunition. There is no other ammunition. From the standpoint of the mask, the mask may help some, but the answer is vaccination. Our great doctor that was with us today said it's a disease of the unvaccinated now. I don't know what else to say. And I thank you so much.